It's always a pleasure to be in a meeting organized by the Spinal Column Society and any meetings we are doing courses and so on. I wanted to try to share, after many years in spine surgery, with perhaps residents and people they thinking to become a spine surgeon, what will be their road for that. So first, we know there are many people are treating spine. They are called spinal specialists, and they are treating spinal conditions. And they are orthopedics, neurosurgeons, rheumatologists, pain specialists, chiropractors, physiotherapists, masseurs, and psychologists. It's a problem that it's the problems of the spine is sometime in their lifespan, 8 to 10 people will have a problem with the spine. So it's perhaps a billion or trillion dollar industry, and so many people are involved in this. But what's a spinal surgeon? A spinal surgeon is a medical doctor who specializes to treat surgically the diseases of the spine. So what we do after medical school, first you have to go in a residency program, either orthopedic or either neurological surgery. We know there was for many years a dispute who is treating the spine. And first time I met Ed, I asked him what was his opinion, who treats the spine best, neurosurgeons or orthopedic surgeons, and he answered to me, the one who knows it better. So if you want to be a spinal surgeon, you need to know your work. So during residency, you must acquire and develop essential skills. You have to learn anatomy of the spine, learn how to document a good medical history. History is one of the most exciting things and also demanding in spine surgery. And also, you have to learn how to examine your patient thoroughly. And during residency, and not only in residency, but in your whole life as a spine surgeon, you have to learn and master the neurological examination. You have to learn how to examine patients for different conditions that could mimic spine diseases. And sometimes it comes a patient that he thinks he has a neck problem and he has a problem with his shoulder. And also other conditions can mimic problems from the spine. And also, of course, you have to study and learn the biomechanics of the spine and also the biomechanics of spine surgery. What will you do to your patient when you do an operation, or what you will change? You have, during your residency, you must observe and participate in spine surgeries. You have to participate in courses, in congresses. You have to participate in hands-on workshop especially. Because when you do go to these courses, you have the first chance to meet you meet doctors with experience. You can discuss with them. They can share their experience, and also you can see how people from different countries can operate, and you learn a lot of that from that. So after you complete your board certification, you must complete you continue your treatment, your training, and you have to become a master of your art. So there is, in some countries, it's essential to go to a spine fellowship program, usually in the United States and also in some other countries. So there is a choice, someone from a country that doesn't need to go to a fellowship program, also to attend to a fellowship program, or we can join a spine-oriented surgical team. And you have to know that if you decide that you are going to be a spinal surgeon, you have to focus only to spine surgery. In the beginning, sometimes you will have other operations. Perhaps if you are an orthopedic surgeon, you have a hip patient, or a neurosurgeon can have a tumor of the brain. But if you want to be updated to your to spinal surgery, you have to go to many workshops, to many things, and so you will leave behind the other fields. So you continue. You have to be also continue to observe and to participate in spine surgeries. Also, you don't stop when you are board certified to join courses, workshops, and participate in congresses. You have to be updated. And also, when you are training, you have to read, always read. You can read anatomy, like the Gray Anatomy. It's not the series, it's the book. And also you can see there's a neuroanatomy through cases, illustrated cases that can help you learn better. You can read also for clinical examination. Here there's two examples of Hoppenfeld orthopedic neurology and physical examination of the spine. Also, you must study biomechanics. You heard Dr. Benzel, he had this book of biomechanics of spine stabilization. For me, is one of the best books I ever read. And also, there's another very good book, Spinal Deformities, The Essentials. Usually, neurosurgeons, orthopedic surgeons tend to treat deformities. Neurosurgeons tend to avoid deformities. But if you are going to be a spinal surgeon, you have to do, I think, you have to master everything. And also, because it's not only surgery, there's also, you can treat patients with less invasive methods like pain management. These are some great books for pain management, Waldman, and also some things you can do it with ultrasound. And also, of course, you have to read books that they describe in not only the techniques, also the experience of the writers, pitfalls, and also how they do it. And of course, you have to learn the procedures. Of course, if I've already Ed told you, this is the official journal of our society, World of Neurosurgery. One has to read also articles, editorials. One of these is a good source is the World of Neurosurgery, but also we have the Spine, European Spine Journal, and also very good is seminars in spine surgery, usually with issues that treat some subjects. And always there is the internet and also videos. Now in our case, you can find videos in YouTube of operations. You have to be careful about the credibility of the information, and also you have to know that even if it's quite easy in the video, that doesn't mean that you can perform it without experience or guidance. Also, you can use different courses. There are courses that they are only without hands-on course, usually seminars. They can give you insight. Also, I usually say that you have to be always to go to the National Congress. The National Congress of your country every year is you meet all your colleagues and you learn from the older colleagues, and you meet your young colleagues and friends. And this is very good for the progression of the spine surgery in your country. Also, you have to go to international congresses, and of course, one of these must be every 2 years, the World Spine. This is from Lisbon, 2018. As you heard, 2020 in South Korea was postponed for the next year. Also, the Spine Week, usually every 4 years, the Eurospine every year, and also the Cleveland Spine Review, hands-on. It's a comprehensive course that you can learn everything you need to know, and it's always changing about 30%, 40% every year. It's a new knowledge. And also there are regional, like the one course we did in Athens last year, or the courses there we are doing in Karachi Spine, and in Karachi, also Indonesia or Coventry, and of course in Homburg. And also now we have, due to the COVID-19 pandemic, we are familiarized with the webinars, and so I think webinars are here to stay. It's a good option for training. So you have to remember that you become master of your art. You can focus only in spine surgery, and even if you decide to do, let's say, minimal invasive, you have to know everything about surgery, spine surgery. You have to know open surgery before you go to minimal invasive surgery. I hear many times people that they are not orthopedic neurosurgeons. I see radiologists, they try to do minimal invasive surgery and they think it's something simple, but sometimes they do disasters. And also, if you don't know well what you are doing, you may have a disaster. And also you have to remember that when you choose to become a spinal surgeon, not only you choose a field, but you choose the life you are going to live, because spinal surgery means long hours, 24 hours a day, availability, 365 days per year, and it's tiresome, but also it's something that gives you pleasure. As you can see, I decided to put some thoughts from spine surgeons. So here's from Nina Land of Sinai Medical Center. He was saying that always remains the most intriguing, complex, and challenging field, the spine surgery. Besides the technical challenges of surgery itself, the clinical challenges of making the right diagnosis was also very appealing to me. And I found also from John Paul Dorman's, he is treating children, and usually, he thinks that these operations are challenging intellectually and technically because they can change the life of a child or a young adult. And surgery in selected patients provides the opportunity to dramatically improve a person's quality of life, as Dr. Goldstein thinks. And also Andrew Hecht, he thinks that you need excellent clinical diagnostic decision-making, as well as superb surgical ability and technique. So, as you can see, most spinal surgeons, they feel great about the decision. You have to do this decision thinking that it's not an easy decision. It's something that you have to do to learn a lot of things. You have difficult patients. You have patients that complain, some patients, but it's something that is rewarding. Thank you very much for your attention, and you can join. This is the site of World Spinal Column Society, and this is a picture from Porto. You can go and register. Thank you.